My name is Ayo, and I'm back again with another video. So like I say in all my other videos, I've been told I talk too fast. So if I talk too fast for you, this is a gentle reminder to reduce the speed and put it at the speed that feels comfortable for you. YouTube has that option. So that's just a reminder. So today we're going to be going over preventative strategies. So we're going to be applying public health concepts to social work interventions. I've seen a few questions that talked about primary prevention, secondary prevention, and tertiary prevention. So I want to make a quick video to talk about this. Try to break it down to make it easy to remember and then go through a few practice problems. So let's just get right into it. So primary prevention. When you think about primary prevention, I want you to think about prevent, right? So the goal of primary prevention is to prevent the problem before it starts. The target group is usually the general population or those who are at risk, but not yet affected. So examples of this looks like parenting classes for new parents, school-wide anti-bullying programs, vaccination campaigns, and healthy eating education, or like a workout or fitness or movement practice that's being launched in a school or in a community. So key phrases to remember, primary prevention, think about stop it before it starts, okay? Next, so secondary prevention. This is early detection. When you think about secondary, think about screening, right? That's the kind of way I put them, SNS screening. So early detection and intervention to reduce severity or halt progression. People showing early signs or at risk. People may be at risk due to where they live, or let's say it's genetic or something like that. Examples of this look like mental health screenings in school, crisis hotline, regular depression screenings at primary care offices, domestic violence assessments in the ER. So when you think about secondary prevention, think about catch it early, okay? And lastly, we have tertiary prevention. So this means that someone has already been diagnosed with something, right? So we reduce long-term effects and prevent complications of an existing condition, right? People already have been affected by this issue. Examples look like therapy groups for patients with PTSD, support groups for substance use recovery, case management for people with schizophrenia, or rehab programs. So when you think of tertiary prevention, think about manage it and prevent worsening, okay? Here are some quick examples for the exam. So thinking about schools, so a scenario, school offering universal mindfulness program to reduce student stress, that's primary. No one has been identified at risk yet. It's prevention for all. A clinic offers screenings to detect early detection of postpartum depression. Secondary, it targets early identification of symptoms to intervene sooner. And a support group for people living with bipolar disorder helps manage daily challenges. So tertiary, the condition is already present. The focus is on reducing long-term impact. So here is a memory tip. Primary, prevent. Secondary, screen. Tertiary, treat, right? If you can remember that, I think it'll be really easy to kind of move through these questions. So primary, prevent. Secondary, screen. Tertiary, treat. Let's get into these practice problems. So question number 1, a public health social worker develops a citywide campaign to promote regular exercise and healthy eating in children to reduce future obesity rates. What level of prevention is this? So is it primary, secondary, tertiary, or clinical, right? So we know it's not D. Clinical is not a prevention strategy. So are we trying to prevent something? Are we screening for something? Or are we treating something? So the answer here would be A. Let me highlight that. Why is the answer A? Okay, highlight. So the answer would be A because this is a universal prevention thing. It targets all children, not just those who are already at risk for being obese or dealing with obesity. It's targeting everyone. They're trying to get it before it starts. That's why this would be a primary prevention strategy. It's promoting health and preventing disease. Okay, that is why this is A. Next question. A social worker runs a weekly support group for individuals who have suffered domestic violence. The group focused on coping skills, emotional healing, and reducing risk of future trauma. What level of prevention is being provided? So is it primary, secondary, tertiary, or restorative? We know it's not restorative because that's not a prevention strategy. So are we trying to prevent something? Are we screening for something? Or are we trying to manage something that already took place? Are we treating something? So the answer here would be C. Okay? Why is it C? So the reason why it's C, individuals have already experienced harm, right? We are working with people who are domestic violence survivors. Okay? This group is there to kind of help reduce long-term effects of the trauma. We are treating something long-term. We're trying to reduce the impact of the problem. That is why C is the correct answer. Also, I know I talk fast. Please pause the video before I start speaking about the answers. We want to take the time to follow along and do the questions with me. So question number 3. A social worker administers depression screenings to all students twice a year to identify those who need mental health support. This is example for what? So are we trying to prevent something? Are we screening for something? Are we treating something? So are we doing primary, secondary, tertiary, diagnostic intervention? The answer here would definitely be B, right? We're screening for something. We're trying to catch something early. So why is the answer B? So B is about early detection. We're trying to catch mental health concerns before they get worse. The students aren't diagnosed yet, but the goal is to find early signs and intervene before full-blown issues develop. That is why this is B. When we think of secondary, remember I said secondary screen, tertiary treat, primary prevent. So we are screening to detect early and to intervene early. That is why B is the correct answer. Let me highlight the whole thing. Okay, I hope you all are doing well. Let's see question number 4. A therapist begins treating a client with schizophrenia to help them manage symptoms, adhere to medication, and improve quality of life. What level of prevention is this? So are we trying to prevent something? Are we screening for something for early detection? Or are we treating something? So is it primary, secondary, tertiary? And we know it's not holistic because that is not a correct answer. So what is the answer? So the answer here would be C for tertiary. Why is it tertiary? Okay, it is tertiary because the person already has a chronic mental illness. The focus here is not to prevent the disorder, but to manage the symptoms and preventing a relapse of them going into the hospital or things like that, right? Tertiary, we're looking to treat. Right, we're looking to stabilize and improve the quality of life of the person with the chronic condition. We don't want things to get worse. Okay, so lastly, question number 5. A non-for-profit offers parenting classes to all first-time parents in the community to promote healthy attachment and reduce the risk of abuse. What level of prevention is this? So is it primary? Are we trying to prevent something? Are we screening for something? Are we trying to treat something? Or are we engaging in preventative maintenance? Okay, so we know it's not D because that's not what we're reviewing. So are we trying to prevent? Are we screening? Are we trying to catch something early? Or are we trying to treat something? So the answer here would be primary. Okay, why is it something? So we are trying to prevent something. Give me 1 second before I explain. So even though the focus is on preventing child abuse or attachment problems, the intervention is being offered to everyone in the general population, new parents, before any signs of a problem exist. This is a preventative education strategy, not treatment or screening. That's why A is the correct answer. With primary strategies, right, it's a universal strategy trying to help everyone. It's trying to prevent future problems. So I hope that made sense. Okay. If you all have any questions, please drop it down in the comments. Like I said in my community post, I plan to have a free study group soon. I'm just trying to see where I can put time to dedicate an hour to have the study group and come up with content and review with everyone. So be on the lookout for that. Look at my community post. Yes. So if you have any questions, just please leave a comment below. I wish you all the best on your licensing journey, and I'll see you all real soon. Thank you, and bye-bye.